A very good evening to everyone. On behalf of Ishan Institute of Pharmacy, Greater Noida, I am privileged to take this opportunity to welcome you all to the webinar on the topic of awareness on bladder cancer 2022. And today we have experts on field of pharmacy and Ayurveda who shall be reflecting on the theme of this webinar. Firstly, I would like to introduce with the theme of this webinar. May is the month of bladder cancer awareness and is a global campaign that focuses attention on bladder cancer. Around 5% of all cancer cases are bladder cancer. Bladder Cancer Awareness Month is about letting people know awareness of about this lesser known form of cancer. To give insights into this extremely promising program, we have with us special guest Dr. Nitika, who is a BMS surgeon working as doctor in Ishan Institute of Ayurveda. Speakers we have Ms. Diksha Sani, Assistant Professor Pushkar Rai, specialization in pharmaceutical chemistry, Assistant Professor Asifa Siddiqui, specialization in pharmaceutics. Bladder cancer is one of the very contagious cancer which takes place. Its symptoms are very common. Maybe someone uh, gets aware about it, or sometimes it's not. So symptoms, the bladder cancer symptoms should be known. I would like to invite our special guest in this webinar, Dr. Nitika, who is working as doctor. I have already mentioned you in Ishan Institute of Ayurveda. Ma'am, it would be very grateful if you introduce yourself too. Thank you, ma'am. Over to you, ma'am.
Thank you, Shivani. I'm Dr. Nitika. I'm a MS in General Surgery in Ayurveda, and I have been working with Ishan Ayurvedic Hospital and Research Center. I have around 7 years of clinical experience in the field after completing my master's in surgery. So, regarding the topic for today, bladder cancer, as we all know, bladder cancer, it might not be one of the leading cancers that are happening in India, but yes, there are around 20,000 cases of bladder cancer that are reported every year in our country itself. Moreover, generally, if we look at it, if we look at cancers in general, what are cancers? Cancers are nothing but that is uncontrolled proliferation or uncontrolled increase in numbers and quantities of the cells of the body. So when these cells, they lose their normal DNA control, they start multiplying in numbers which are not required or not suited for that environment. That is basically a cancer. And now these cancers are divided into two major categories, that are the benign cancers and the malignant cancers. Benign cancers are like growths which are happening somewhere in the body. They'll be situated there, cells will multiply and form a tumor there. So that is a benign cancer. And if we look at malignant cancers, when these benign cancers, they keep proliferating, they keep entering into the tissues, eventually they enter the bloodstream or the body fluids, and they are spread far and wide. Now, the speciality of these cancer cells is even if one of them is dislodged and it goes into the bloodstream, it can create cancer in any other region of the body that it is happening. So that is a when these cancerous cells travel from one place to other that and cause a cancer there, that is a secondary cancer, which is very common in case of bladder cancers. Bladder cancers many a times are secondary cancers. So basically, if we look at the urinary bladder, the normal cells of a urinary bladder are called a urothelial cells. So this is a cancer of the urothelial cells, which can very easily turn malignant. So the problem with this is that the bladder cancer very easily converts into a malignant cancer. And many a times when we see that it is a secondary cancer means already there is malignancy in the body. So spread is already there. There is cancer somewhere else, and then it travels to the bladder and causes cancer there as well. If we look at it, generally these bladder cancers are found in adults and much more in male population as compared to the female population. Females are much lesser in numbers when we look at it. Now, what is most important is that in today's health statistics, India is standing at 17th rank in the world in the incidence of bladder cancer. So in the world, we are one of the leaders in bladder cancer. And if you look at the mortality or the death rate, we are 19th in the world in the mortality rate or death rate of bladder cancer patients. So most important in treatment of a bladder cancer or in diagnosis of a bladder cancer is early reporting. So if there is early reporting, there are better chances of improvement, there are better chances of treatment, and easier cure is available. Most important here would be, how do we recognize what are the warning signs? That is most important for a layman. How do we know that we need to visit a doctor or get ourselves checked? So if there is any unexplained bleeding in the urine, that is the first and foremost symptom that you will see in bladder cancers. So that bleeding can be in the form of fresh red blood in the urine, or it can be in the form of clots, or else it can be in the form of old bleeding, that makes the urine look dark maroon colored. So if your urine is having any signs of bleeding, if it is bright red, dark red, maroon, blackish, or if it is having slight clots, it is high time you must visit a doctor and get yourself checked. Besides that, if the frequency of your micturition or frequency of urination has increased, the number of times that you are going has increased in the past few days, that means you must cross verify for chances of a bladder cancer. Besides that, if the patient is experiencing backache in the lower region of the back, if there is backache on one side, again, it is one of the warning signs that we see in bladder cancer. Besides that, if there are very recurrent urinary infections, then again you must get yourself checked. You are at a higher risk for this disease. And also, if you are experiencing any pain or burning sensation in the urine, then you must visit a doctor. You must get yourself checked, because all these are the warning signs. If you're having any of these, all might not be present in all the patients, but even if you're having one of these, you must visit a health specialist, a doctor or surgeon for getting yourself checked in regard to bladder cancers. The most important thing here is the treatment will depend on the staging of the cancer. So if you are coming to the doctor at an early stage of the disease, treatment is much easier as compared to if somebody is coming to the doctor and visiting the specialist at a very later stage, then it keeps getting that much complicated. Initially, in the initial phases, maybe with only palliative treatment like radiotherapy or chemotherapy, this might be uh, controlled. But on the other hand, if you are coming very late, then in many of the cases we have to go in for surgical intervention. Surgical intervention will include removal of the bladder, or sometimes removal of the prostate along with the bladder, or the surrounding tissue, depending upon how late the patient has been. So for all these cancers, for bladder cancer in specific and for all other cancers in general, it is very important that an early diagnosis can give a better treatment. Now, one more very important thing here is the risk factors. What all lifestyle or what all dietary problems can put us at a risk of developing uh, bladder cancer. Now, the most important one here is smoking. A higher rate of smoking is directly proportional to increased incidence of bladder cancers. So, if you have a smoking history, you have to be very careful with your health. We all are very much aware that smoking is very much injurious and it is hazardous to the health. But it is hazardous not only in terms of developing of oral cancer or a throat cancer. Bladder cancer patients also, on a major scale, have history of long history of smoking. Besides that, generally, as we talked earlier, it is seen in the adult population. So people who are aged over the over 50 years, they are at a greater risk of developing bladder cancer. Then genetically, men are more predisposed to bladder cancers as compared to females. Besides that, if people who are working in the manufacturing industries and who are in constant contact with chemical agents like dyes or leather textile industries, paints, and they are not taking enough precautions, it is again a very important predisposing factor for development of bladder cancer. Then, as I said earlier, that this is a secondary cancer. Very often, it is a secondary cancer. So, cancer of some other region may be treated or not treated. Sometimes patients who are having an earlier history of cancer come to us that it had been cured, and later on, after maybe 10 years, they developed another secondary. So that is because of the malignancy, the cells sometimes go and settle somewhere else in some other organ, and then they create a cancer there. So other cancers or history of earlier cancer treatments or cancers is also a risk factor for bladder cancer. Besides that, again, carcinoma or cancers are familial. So if there is a family history of carcinoma, then again, it predisposes you to develop bladder cancer. Another thing is people who are having chronic bladder inflammations, chronic bladder infections, or very recurrent untreated bladder infections, they are at a very high risk for developing bladder cancers, because what happens is the local tissue keeps getting irritated with there are more free radical generation, there is more irritation, more inflammation, more inflammatory reactions, and the tissues keep getting damaged with each and every reaction that is happening there. Untreated, long standing inflammation of the bladder or infections of the bladder can lead to bladder cancers. Besides that, another thing is contamination of water. Water which is contaminated with arsenic is seen to trigger bladder cancers, because whatever excretion of water is happening through our kidneys to ureters, bladders, and through the urethra it goes out. So water that is contaminated with arsenic is a very major source or a very major risk factor for developing bladder cancers. So bladder cancer is completely treatable. There is nothing to be scared of it. The thing that the best we can do is to be aware. So if we are aware, if we are well oriented, if we are looking after our health and avoiding the risk factors, then it is very easy for us to tackle this bladder cancer or any cancer in general as well. So the need here is to be aware rather than being ignorant. Thank you so much. Thank you, Shivani ma'am.
Thank you so much, ma'am, for enlightening us with the knowledge of bladder cancer. It was an honor to have you with us. Thank you so much, ma'am.
I'm grateful to you for the same.
Now I would like to welcome Miss Diksha. Over to you, ma'am.
Thank you, Shivani ma'am. A very warm good evening to all of you. I, Diksha Sani, lecturer at Ishan Institute of Pharmacy, once again welcomes you all. So, as we all know, today's webinar entitled as Awareness on Bladder Cancer. Uh, so, we are going to discuss about bladder cancer, but first we need to understand what is cancer. Okay, so what is cancer? So we all know cells are the basic unit that make up the human body. Cell grow and divide to make new cell as the body needs them. Usually, cell die when they get too old or damaged. Then new cells take their place. But cancer begins when genetic change interfere with this orderly process. Cells start to grow uncontrollably. These cells may form a mass called tumor. A tumor can be cancerous or benign. A cancerous tumor is malignant, meaning it can grow and spread to other parts of the body. A benign tumor means that tumor grow but it will not spread. Here are various kind of cancer. Cancer can occur in larynx. Cancer can occur in mouth, pharynx, lungs, stomach, colon, uterus, and it can also known as leukemia cancer. And also it can occur in our esophagus, pancreas, kidney, bladder, and cervix. So our today's topic is bladder cancer. Here are the male and female urinary system. A bladder cancer develops when in the a bladder cancer develops when the cell in the bladder begin to grow abnormally, forming a tumor in the bladder. Bladder cancer is common type of cancer that begins in the cell of the bladder. The bladder is the hollow muscular organ in your lower abdomen that store urine. Bladder cancer begins when cell in the bladder develop change mutation in their DNA, a cell DNA instruction that tell the cells what to do. The change tell the change tell the cell to multiply rapidly and go on living when healthy cells would die. The abnormal cells form a tumor that can invade and destroy normal body tissue in the time, and the abnormal cells can break away and the spread metastasize through the body. Here is the difference in normal bladder or a cancerous bladder. Bladder cancer can most often be in the cell, urethral cell that line inside of your bladder. Urethral cell are the cell are also found in your kidney and the tubes of uterus that connect the kidney to the bladder. Urethral cancer can happen in the kidney and uterus too, but it much more common in the bladder. Most bladder cancer are diagnosed at an early stage when the cancer is highly treatable. But even early stage bladder cancer can come back after successful treatment. For this reason, people with bladder cancer typically need follow-up tests for years after treatment to look for the bladder cancer that recurs. Here are some early symptoms of bladder cancer. So, as we all know, blood in urine can occur, change in the bladder habit, increase and frequency or urgency in urination, difficulty passing urine, or pain or burning sensation during urination. Now we are going to discuss what are the symptoms of bladder cancer. Bladder cancer sign and symptoms may include blood in urine, abdominal pain, lower back pain or backache or bladder irritation. So blood in urine is also known as hematuria, which may cause urine to appear bright red or cola colored, though sometimes the urine appears and sometimes urine appears normal and blood is detected on the lab test. Sometimes urination or frequent urination and bladder irritation, painful urination, back pain and abdominal pain. Blood in urine can turn brown usually and need to urinate on more frequent basis. Bone pain, pelvic pain, same. Now we are going to discuss about prevention from bladder cancer. So we can prevent bladder cancer by quitting tobacco, staying hydrated, wear breathable, loose fitting clothing, avoid some weeds and fungi, and if we don't drink arsenic and chlorine treated water, or if we limit our workplace paint, dye, metal, and petroleum exposure, or wipe front to back after peeing, or urinate after sex. Here are some types of bladder cancer. So different types of cell in your bladder can become cancerous. The types of bladder cancer where cancer begins determine the types of bladder cancer. Type of bladder cancer include urothelial carcinoma, squamous cell carcinoma, or adenocarcinoma. So, urothelial carcinoma is previously called as transitional cell carcinoma, occurs in the cell that line inside the bladder. Urothelial cells expand when your bladder is full and contract when your bladder is empty. These same cells line the inside of the uterus and the urethra, and the cancer can form in those places as well. Urothelial carcinoma is the most common type of bladder cancer in US. And now second is squamous cell carcinoma. Squamous cell carcinoma is associated with chronic irritation of the bladder, for instance, from a infection or from a long-term use of urinary catheter. Squamous cells bladder cancer is rare in US. It's more common in the parts of it is more common in the parts of the world where certain parasitic infection is common cause a bladder infection. Next is adenocarcinoma. Adenocarcinoma begins in the cell that make up mucus secreting glands in the bladder. Adenocarcinoma of the bladder is very rare. Some bladder cancer include more than one type of cell. Here are some risk factor. So factor they may increase bladder cancer include smoking. Smoking cigarette, cigar or pipes may increase the risk of bladder cancer by causing harmful chemicals to accumulate the urine. When you smoke, your body process the chemical in the smoke and excrete some of them in urine. These harmful chemicals may damage the lining of your bladder, which can increase your risk for cancer. Exposure to next is exposure to certain chemicals. Your kidney plays a key role in filtering harmful chemical from your bloodstream and moving them into your bladder. Because of this process, it's thought that being around certain chemical may increase the risk of bladder cancer. Chemical linked to the bladder cancer risk is include some like arsenic and chemical used in the manufacturing of dyes, rubber, leather, textiles, and paint products. Other risk factors that may cause bladder cancer are increasing age. Bladder cancer risk increasing as you age, though it can occur at any age. Most people diagnosed with bladder cancer are older than 55. And being a male, men are more likely to develop bladder cancer than women are. Next is previous cancer treatment. So treatment with anti-cancer drug cyclophosphamide increase the risk of bladder cancer. People who received radiation treatment aimed at the pelvis for previous cancer have a higher risk to develop bladder cancer. Next is chronic bladder inflammation. Chronic or repeated urinary infection or inflammation, such as might happen with long-term use of urinary catheter, may increase the risk of squamous cell bladder cancer. In some area of the world, squamous cell carcinoma is linked to chronic bladder inflammation caused by the parasitic infection known as scutomasis. Some other risk factors are personal or family history of cancer. If you have had a bladder cancer, you are more likely to get it again. If one of your blood relative, a parent, sibling, or child has a history of bladder cancer, you may have an increased risk of the disease. Although it's rare for bladder cancer to run in families, a family history of Lynch syndrome, also known as hereditary non-polyposis colorectal cancer, also known as HNPCC, can increase the risk of cancer in the urinary system as well as in the colon, uterus, ovaries, and other organ of the body. And that's it from my side. Thank you all.
Thank you, Viksha ma'am, for elaborating about bladder cancer along with its symptoms. It was very informative. Let's continue the program. Now, I would like to welcome our next speaker, Assistant Professor Pushkar Rai, specialization in pharmaceutical chemistry. Over to you, sir.
Today is webinar on topic awareness on bladder cancer. So I explain introduction and types of bladder cancer and advantage of drug and MOA, mean mechanism of action. First, I have explained introduction about bladder cancer. Topic on awareness on bladder cancer. I have explained introduction. Bladder cancer is a common type of cancer that begins in the cell of the bladder. The bladder is a hollow muscular organ in your lower abdomen that stores urines. In slide, these images female urinary system, which includes, and I have explained, which include the kidney, uterus, bladder, and urethra. These type of organs are present in female is responsible for removing waste from your body through urine. Your kidney located produce urine by filtering waste and fluid from your blood. That urine then travels through your uterus to your bladder, where the urine is stored until you can eliminate it at an appropriate time. Bladder cancer most often big in the cell urethral cells. Mean urethral cells are present in bladder, so-called urethral bladder cancer. Its other name urethral bladder cancer that line the inside of your bladder. Urethral cells are also found in kidney and the tubes, uterus that connect the kidney to the bladder. Urethral cancer can happen in the kidney and uterus too, but it's much more common in the bladder. Then in slide, this urinary system, male urinary system, which include the kidney, uterus, bladder, and urethra. And one common difference, male and female urinary system. So one difference is prostate. Prostate are present in male urinary systems. They can excrete urine in body. It is responsible for removing waste from your body through urine. Your kidney located towards the back in your upper abdomen produce urine by filtering waste and fluid from your body. That urine then travels through your uterus to your bladder, where the urine is stored until you can eliminate it at appropriate time. Then this is a type of bladder cancer. Generally four types of bladder cancer. Uh, First, urethral carcinoma of the bladder cancer. Carcinoma means this type of cancer occur in epithelial tissue. This type of tissue are present inside the skin. Most bladder cancer, about 90% being in the cell on the surface of the bladder inner linings. This type of cancer is called urethral carcinoma. I have already tell about carcinoma, also called transitional cell carcinoma. Most urethral carcinomas are non-invasive. That means the tumor stay within the bladder inner linings. Urethral carcinoma grow are two types. First, papillary urethral carcinoma and second, flat urethral carcinoma. First, I have explained first type, papillary urethral carcinoma. This type of cancer is cylinder finger-like projection toward the center of the bladder. In slide, showing image, this blue type of hollow organs is bladder. So, this type of cancer, papillary tumor, like cylinder finger-like projections show in image. Flat urethral carcinoma. Such carcinoma in situ mean inside the body grow flat on the wall of the bladder. Mean this type of cancer are grow in tissue. And second, squamous cell carcinoma of the bladder. Squamous cell carcinoma in the second most common type of bladder cancer. This cancer beings in the thin flat squamous cells that may form in the bladder after chronic inflammation and infections. I have already shown in image this type of white linings. So squamous cell carcinoma cancer. And third type, adenocarcinoma of the bladder cancer. The rare form of bladder cancer accounts for about 1% of cases in whole world. Adenocarcinoma can be associated with certain bladder defects at birth, as well as with chronic infection and inflammations. Adenocarcinoma identified the radiology. This is a type of therapy and show adenocarcinoma cancer. In the white linings show in figure, this called adenocarcinoma cancer. And four types: small cell carcinoma of the bladder. This aggressive form of a disease being in small nerve-like cell in the bladder called neuro neuroendocrine cells. These in this figure, the purple color show uh, neuroendocrine cells. This type of cancer occur in a particular in specific cell. Small cell carcinoma makes up about 1% of the bladder cell. It is often detected at an advanced stage after it has spread to other parts of the body. Uh, this is a drug used in bladder cancer treatment. These are easily available in chemist shop. Atezolizumab, avelumab, third type, Valversa, fourth Bavencio, and fourth type Cisplatin, dox, doxorubicin hydrochloride, and mitomycin and valvulvicin. And I have explained cisplatin, the advantage of cisplatin. This type of drug administered IV. Second, known cycle specific killing, highly bound to plasma proteins, gets concentrated in kidney, intestine, and testes, poorly penetrates blood-brain barrier, slowly excrete in urine. This is the chemical structure of cisplatin, and platinum and chlorine and ammonia are connect with platinum. Then dose required are 20 mg for 5 days a week and 75 to 100 mg once in 4 weeks to treat bladder cancer. Then mechanism of action. I have explained 13 steps are in mechanism of action. I have explained one by one. First of stage first, cisplatin hydrolyzed. Cisplatin becomes activated once it enters the cell. In the cytoplasm, the chloride atom on cisplatin are displayed by water molecules. That means in this reaction, this cisplatin structure and water molecules present in body so react with chlorine because hydrogen electronegativity is 2 and oxygen is 3.4 and 5 something. So easily replaceable chloride ion and bound water molecules in platinum, so 1,000 times more active than normal cisplatin. This hydrochloride product is a potent electrophile that can react with any nucleophile, including the sulfhydryl groups on protein. Sulfhydryl groups are also present in protein and nitrogen donor atom on nucleic acid. Then second step, cisplatin induce oxidative stress. Under normal physiological conditions, cell control reactive oxygen species level by balancing the generation of reactive oxygen species with their eliminating by scaring system. Reduce glutathione means GSH, superoxide dismutase SOD and catalyst. And glutathione also reduce. I have also shown image this GSH glutathione oxidative stress cisplatin react with water molecules, then oxygen are present in oxidative stress, then uh, decrease the glutathione, then next stage DNA damage. Thus, cisplatin modulating of calcium signaling. Cisplatin under low intracellular chloride ion concentrated I has been shown hydrolyzed into various charge negative species, including monoaqua, mean 1 moles of water are present in cisplatin with cisplatin drug, and diaquated, mean 2 moles of water molecules are present with cisplatin. These hydrolyzed form of cisplatin have been shown to be 1,000 times more active than normal cisplatin. I have also explained in first step. Then fourth step, Cisplatin induce cell apoptosis. Apoptosis means cell death. Apoptosis is a controlled type of cell death, which is energy independent, leading to cell shrinking, means cell shrink, chromatin condensation, membrane budding, and activation of a family of cytosine protease called caspase. Caspase activation is a key step in the beginning of apoptosis, and several stimuli activates caspase, including those that activation plasma membrane cell death receptors. Caspase 8 are responsible for activated plasma membrane cell death, and caspase 9 are responsible for cause mitochondrial dysfunction. And step 5, cisplatin and protein kinase C. Protein kinase C is a family closely related phospholipid dependent enzymes that play critical roles in signal transduction and cell regulations. And step 6, cisplatin and mitogen-activated protein kinase, the short form MAPK. They are family of structurally related serine, threonine, these type of protein kinase that coordinates various extracellular signals to regulate cell growth and survival. Cisplatin has been shown to cause activation of ERK, mean this is a full form extracellular signal regulated kinase. This type it is a protein. Its several cell type also there are controversies whether activation of ERK. I have also explained full form of ERK extracellular. Then I repeat extracellular signal regulated kinase prevent or contributes to cisplatin induced cell death. Stage 7, cisplatin and gun amino terminal kinase. Gun and terminal kinase or stress activated protein kinase is activated by various stress stimuli including DNA damage. Both cis and trans form of cisplatin activated the JNK pathway. That means cisplatin as a drug, cis type mean function group in a same side, and trans or function group of opposite sides are present in structure. They are they are activated the JNK pathway. And stage 8, cisplatin and mitogen activated protein kinase MAPK. Environmental stress is an important moderator of cisplatin induced apoptosis. I have also explained apoptosis means cell death by activating P38. This is a small type of protein. This is related to MAPK family. It has already been identified that EGFR full form epidermal growth factor receptor as a substance for P38 MAPK, and cisplatin induced receptor internalization was triggered by P38 mediated phosphorylation of the receptor. Phosphorylation means phosphorus compound are added in with cisplatin. Stage 9, cisplatin and AKT. AKT belongs to a family of serine. AKT is a small type of protein. They are present in body. Uh, serine threonine kinase, which act downstream of phosphoinoside 3 kinase, mean P13K, and play a critical role in the cell survival. It has been demonstrated that cisplatin-induced DNA damage caused phosphorylation of BAD at SIR-136, mean serine-136 via AKT. Stage 10, cisplatin and signaling for DNA damage. Mutations are caused by several signals associated with stress. The second, DNA-only damage are followed by activation of cell cycle checkpoints, thereby delaying the cell cycle progression either to repair or to permanently eliminate the cell by inducing the cell death. Stage 7, P53, this is a protein, the helpful cell apoptosis for cell apoptosis and DNA damage response to cisplatin treatment. P53 is a protein, is a short-lived protein which is activated for phosphorylation by ataxia telangiectasia mutated ATM on DNA damage signals. The activated P53 now in turn activates MDM2, mean mouse double minded to hemoglobin. This is a full form which is E3 ubiquitin ligase. P53 can trans-activated genes involved in cell cycle progressions, DNA repair, and apoptosis. Stage 12, CABL and DNA damage response to cisplatin treatment. CABL means cyclobutadiene carboxylate. ABL is tyrosine kinase receptor and contain nuclear localization modifies and nuclear export signals upon upon DNA damage. CABL, I have also telling you ABL full form is required from cytoplasm to nucleus, later associate with an phosphorylates MEK kinase first. This complex activates can amino terminal kinase, stress activated protein kinase, and last stage 13, cisplatin modulation of gene expression. Cisplatin also induces endoplasmic reticulum stress and nucleus independent apoptosis signaling. Because cisplatin is a DNA damage agent and inducer of apoptosis, it is reasonable to expect change in HSPS in the development of cellular resistance to the drug. Metallothioneins and other antioxidants increase the level of DNA repair. This is all about 13 steps are MOA, and thank you so much.
Thank you so much, sir, for such enlightening insights. It actually demonstrates role of pharmacy, especially pharmaceutical chemistry, in treatment of bladder cancer. Our next esteemed speaker is Assistant Professor Asifa Siddiqui, specialization in pharmaceutics. Over to you, ma'am.
Shivani ma'am. Good evening, everyone. I am Ashifa Siddiqui, Assistant Professor in Ishan Institute of Pharmacy. So we are discussing here awareness on bladder cancer. So I'm going to show you some slides that I have prepared and explain in this. So first of all, don't go red, go to doctor. It means this campaign aims to raise awareness of the signs of bladder such as blood in urine and urges people to seek medical attention if they experience symptoms. So don't go red, go to doctor. Awareness on bladder cancer, as we all know that each May we are we are here to aware all public, all peoples on bladder cancer. This month, those in the bladder cancer community to join together to increase awareness of the disease and raise much needed funds for bladder cancer research as well as patient education. So our next aim is bladder cancer awareness ribbon. They are customizing some accessories to show us that mostly widely expected ribbons by various bladder cancer organization is the color orange. Some people use yellow ribbon. The tricolor ribbon is most broadly utilized for bladder cancer in United States. Bladder cancer story. Bladder cancer story. It is our hope that my bladder cancer story campaign will be an avenue for those affected by bladder cancer to share their stories, to be a voice for those who for far too long have felt alone in this fight against this disease. So most of the people, those who are suffering from bladder cancer, they also experience mental health implications in bladder cancer. Like mental health mental health, poor mental health can impact surgical implications, rates, and oncological outcomes. Bladder cancer patients have increased risk of suicide, especially in advanced stages. Psychological illness such as depression and anxiety coexist with the bladder cancer. So, to fight with the anxiety, here we are going to tell you about the treatment by yoga. This practicing yoga, sound therapy, pranayama, acupuncture, acupressure can help in long run. What is acupressure? I'm going to tell you something about that. Acupressure is it is a form of alternative therapy in which manual pressure is used to stimulate a specific point on the body. And acupuncture, this is different from acupressure. It is like stopping pain by putting thin needles into the body parts. Okay. Sometimes traditional cancer medication can rob the body of its strength once symptoms are cured. So here is Rasayan Chikitsa. Rasayan Chikitsa can help the body regain its strength. Rasayan Chikitsa, what is Rasayan Chikitsa? We are preparing various type of herbal products, herbal formulations like Chamanprash, Avleha, and in herbal products like Amla, we use Amla, Harad, Guduchi. This product will help you to treat in the anxiety, and also Rasayan Chikitsa will help you to body regain its strength, metabolism, memory, longevity of hair and complexion. It brings back the vigor that was lost. Now a yoga sequence like asanas, we will going to perform different type of asan to treat us anxiety, stress, like crown pull, spinal, calf care pose, and blowing out candles, all for child, balasana. These are some of the asanas we have to perform to reduce stress, anxiety after bladder cancer. जिसको हो जाता है, treatment by Ayurveda. We have so many treatments in Ayurveda that will why we are focusing on Ayurveda, because it is because Ayurveda will have no side effects. No, these all are natural. So bladder cancer treatment by conventional medication can be complicated, complemented by Ayurveda, especially with the Panchkarma. Panchkarma, it is very, good yeah, if you know about Panchkarma. Panch means five, and karma means procedure. So, five procedure we are going to follow to treat anxiety, stress after those who are going through surgeries. Sneha, this is therapy which detoxify the body. Panchkarma will detoxifies the body. Detoxification can be done by different methods. The first is snehana therapy, that is oil massage. You will understand that oil massage means massaging from different aromatic medicated formulated oils. Svedna, that is steaming therapy. We will going to give them steams. Vamana, that is urging vomiting to detoxify. Sometimes vomiting is good for our health. Vamna, that is, Virechna, that is purging. Now, Virechna is something, interesting. So, Virechna, I'm going to tell you about this. Generally, on fourth day, the person is instructed to skip his or her dinner, take a hot bath, then undergo purgation, which means Virechna, by ingesting castor oil or other laxative which are properly indicated. Next is Basti. the enema medication. Basti is the enema medication. In this, we are Basti, the medicated oil or herbal detoxification is administered through the anal route, different rules, different routes. In modern medicine, enemas are most commonly given in the lower clean the lower bowel as the last resort for constipation treatment when all other medications fail. All other methods, fail. Now, last is NISA. NISA or through the nasal medication, we are going from this route nasal. We going to put some aromatic oils and medications by the route of nasal, and last is Rakta Mokshana therapy. Rakt Mokshana therapy. In Hindi, we will easily understand Rakt means blood and Mokshana means liberated, means get out from the body. What get out from the body? Releases impure blood from the body, please get out. It is like that. And yeah, Rakt Mokshana therapy is very good. So thank you so much for listening.
Thank you so much, ma'am, for letting us know about the Bladder Cancer Awareness Month and sharing natural therapy to treat bladder cancer. As we reach the end of this webinar on awareness of bladder cancer 2022, I believe that I have had extremely fruitful webinar. I would once again express a word of gratitude towards our special guest, Dr. Nitika, who have joined us. Our speakers, Ms. Diksha Saini, Assistant Professor Pushkar Rai, and Assistant Professor Asifa Siddiqui, and technical team. I am also grateful to all those who joined this webinar. Thank you so much for
Thank you. Thank you, Shivani
Thank you.
ma'am.
Yes,
Thank you, everyone.